Welcome back to the Playdate by Freshly Picked. I'm your host, Kaitlin Hansen.
And I'm your host, Krista.
Krista, it's been a minute. How are you?
So good. How are you?
Good. Enjoying summer.
Oh my gosh, right?
Yeah.
We just went to Cowabunga Bay for the first time.
Oh, my kids have been wanting to do that.
It's so fun.
Oh,
it's so
I love
fun.
that. A lot of my friends have passes there.
I probably need to get a pass.
Yeah.
It's probably worth it.
Yeah. I'm like, I hear that it's good for older kids too, because there's like all the water slides, but then there's like a kiddie section. So I'm like, I need to do that.
Yeah, it's so fun.
What else have you guys been up to this summer so far?
Let's see. Yesterday we did like every summer thing ever in one day, and
just
I'm exhausted.
checked it off.
Yes, we did. We did splash pad.
Oh, fun.
We went to Trader Joe's and we got like popsicles and trees.
Cute.
It was so fun. We went to Thanksgiving Point and rode the pony.
Oh yeah.
It was so freaking hot.
Oh my gosh. And there's always the longest line.
You know, there wasn't, luckily, because people were smart and stayed home.
They're like, we don't want to ride.
You know, they're literally like, okay, we're going to stay home.
Oh my gosh.
We were like, okay, here we go. Rode the pony. She did so good.
Cute.
My little one's 16 months. She like was so proud of herself.
I need you to send me a picture after this.
It's so
or
cute.
show me one.
I'll show you. Yeah. She was so proud of herself. It was adorable. And then I hosted my book club.
Oh, nice.
And it was so fun. We talked about our childhood like sexual awakenings. Like who was that for you?
Yeah.
And mine was like Max Goof.
I don't even know who mine was.
Yeah. Think about it.
Max Goof.
What about Peter Pan? The live action Peter Pan?
Oh, Peter.
Peter.
Yeah.
Yes. I think his name's Jeremy.
Yeah. It's like, I do believe in fairies.
Yes.
I do. Yeah.
I do. Yes. Oh my gosh. Yeah.
I mean, you need to think.
So it was a good book club, needless to say.
Fun. Oh my gosh. I like that.
Yeah.
Good.
So fun.
Well, today we're going to be talking about planning for postpartum. It'll be good because we both had different birth experiences and things. So I'll be talking about kind of how I prepared and things that worked well for me from a C-section perspective. And then you will talk about yours from a vaginal perspective.
Yes.
Which I'm like, I don't love that combination of words together, but that's great.
Yes. Yeah, I know. All the words that like go into postpartum and being pregnant.
But it is what it is.
Lots of fluids.
Yes.
There's lots of things going on.
Yes, it is what it is. So, okay. So I guess like first things first. I mean, going into things, I didn't know that I was going to have a C-section. So for the first, I planned everything like I was having a vaginal
normal
delivery.
Not normal. Sorry.
No.
I don't mean to use that word.
No, you're fine.
Vaginal.
Yeah. So I'm like, I planned everything like that. Like got the Tux pads, got
you don't need those.
Yeah. Got like the Dermaplast, which is like an itch spray, and all the peri bottles and all the kits and all the
PTSD.
things. Yeah. So I'm like, I got all of that. And then I ended up not needing to use any of it. And then for my second, I obviously was like so much more prepared because when I went into my C-section, it was an emergency. I only knew one other person that had a C-section, and it was my cousin.
Okay.
And luckily she was great. She actually like came to the hospital the next day because I like had all these questions of like, and she was like, you need to ask for this, and this. Yeah. So
how did that affect your, sorry to cut
No.
How did that affect like your mindset? It's being called an emergency. Like, are things moving too fast for you to like process what's going on in your head?
Oh yeah. It went from like being the chillest situation ever because like I got my epidural. I couldn't feel a ding dang thing. And then I was pushing and I was like, I'm not saying this as ever. Oh, I pushed for 2.5 hours. And like all of that was well. And I don't want to like discount other people's like feelings or anything like this. But when I was pushing, I guess I just like had in my mind like the pictures from like movies where everyone's just like screaming and just like, ah. And I was like laughing and I was like, this is what it is.
Yeah.
I'm like, it really just feels like I'm like gonna poop my pants.
Yes.
But but I'm like, this is what it is. And then, it went from being so chill to really scary where they're like, okay, hurry, and like had my husband suit up. Then we had to like sign all these documents and things. And then they're just like pushing you quickly to the OR. And then
I can't believe, like, I know that you have to sign the documents, but I just didn't like put that together.
Oh,
that you're having an emergency and they're like, sign this 26-page form.
Yeah. I'm like, I don't know what it said, but yeah, my husband's like filling all this stuff out. Then they push the bed into the OR. And then it just like becomes really real and scary. Like you can just like see all the instruments and you're like down, and then they have to bring in like an additional doctor and nurses and things like that. So I was like just so scared and like shaking.
I'm so sorry.
No, it's all good now. I'm like, I had a redemption birth.
Okay.
So it was good. But yeah, it went from being chilled to scary.
Oh my gosh. Yeah. That's so frightening. And for any mom out there who's like experienced that, or like, I'm sure there's trauma that goes along with that.
I went to therapy.
Oh, good.
Yeah.
Good. Go to therapy.
Yeah.
We talk about that every time.
Oh, yeah.
But yeah, just it's so unfair because it feels like you're kind of robbed of that experience of meeting your baby.
Totally. And I didn't find out gender. So when she came out, I was like barely there.
Did they give you more drugs?
Yes.
Oh, so you had an epidural.
And I was like shaking. You're like strapped to like a cross. And
what?
Yeah. I was like shaking because they're like cutting into your stomach. The anesthesiologist was like rubbing my head, and then I was like throwing up during it too. So I'm like, it wasn't great. So like when they told me that it was a girl, I'm like, I'm not even all there.
I'm so sorry.
No, it's okay. I had another one, but there's a few things that happen during a C-section that I didn't know about. And anytime you have abdominal surgery, you're at a risk for getting air pockets in your shoulder. Okay. And that was actually the most painful thing after birth was the air pockets. And so my cousin,
I've never heard about this.
Yeah. So I'm like, yeah, just like when it's open, air pockets can go to your shoulder, and it's just like the most aching, stabby feeling. So she was like, ask for a water heating pad for like your shoulder. So then I did. And then it was like, oh my gosh, this is great. And she's like, ask them for a band before, like a belly band, before you get up and like start walking. And then I was like, okay. So I did that and it was great. And then for my second, then I was like, okay, I know to immediately ask for that. I know to ask for the belly band. I know to have them like refill my ice and just keep packing it every, little bit. So that helped.
That's such good advice.
Yeah. I'm like, I just didn't know.
I'm so glad you had your cousin to tell you that.
Oh, thank goodness for her. Because I would have probably just like suffered with my air pocket shoulder. It was kind of crazy.
I have never heard about that. That sounds horrible.
Yeah. I'm like, I guess that's
an
air
thing. Pocket? Air pocket shoulder?
And it like has nowhere to go. So it's just like trapped in there. Yeah.
My mind is blown.
Oh, yeah. And then like a couple things I did differently too after I knew my second birth, I decided to not have a single visitor.
Nice.
Like not even come to the hospital. I had no one. And that was really nice because with my first, I felt so overwhelmed with like the amount of people. So that's like one thing I did to kind of prepare for that.
Especially after that traumatic birth that you had.
Yeah.
Everyone coming in wanting to be so happy.
Oh, it was like 30-something visitors the first day.
You're just like, I am so traumatized. Like,
yeah, I'm like, I need a minute.
Good for you for setting those boundaries for the next one, because that is so scary.
Yeah. That was like, anyway, those were just like a couple of things that I first did to prepare. Tell me about what you have done to prepare.
Okay, so I am kind of dumb. And so listen to the story, and then you can,
and then I'll give my vote.
And then you'll decide. Yeah, you can vote. So I was not afraid of giving birth.
Yeah,
I was like, yeah, it's gonna be scary, but it's gonna be like a day, you know. And then I was mostly afraid for postpartum. I was like, it's gonna be so hard. I was terrified of breastfeeding.
Yeah,
terrified. And
with good reason.
Yeah, for real. I was just terrified. I did nothing to like help that or like I was reading all of the pregnancy things. I was reading all of the baby sleep things.
Yeah.
But as far as like healing for myself and like, what's going to happen to my body like after postpartum, nothing.
Honestly, I didn't either. Like I walked out of I went to a birth class.
Oh, nice.
I went to a breastfeeding class and a birthing class. And like the birthing class, I like walked out during like the C-section part, and then I didn't go to like
You're like, oh, this doesn't apply
the
to
recovery
me.
ones. I'm like, I'll never have a C-section.
Oh my gosh.
And then I went to like a breastfeeding class, but like I didn't, and I still am like not great on knowing like female anatomy and all the things. So I'm like, I don't know what they like cut into. I'm not sure what they did.
Yeah.
But yeah, so I'm like, I went to a couple of those classes.
Yeah. I like downloaded a free breastfeeding class.
Nice.
And I watched it and the women kept pulling out their nips and I was like, this isn't for me.
Yeah. Yeah.
Like, I was so uncomfortable, which is dumb. Like it's so beautiful and stuff, but I was like,
yeah,
never mind.
It's just not for you.
Yeah.
Yeah.
People have weird titties, you know?
Like, they do.
Like,
they do.
I don't want to see them.
Every pair is different.
Yeah. And it's beautiful.
It is.
But, you know, for yourself.
Yeah.
Or for your, yeah. Anyway. That's
no,
weird.
I could see how that would be like shocking. Where you're like, whoa.
Yeah, it was so weird. So I wasn't very prepared for postpartum things. I knew and had heard rumors of the spray and the ice pads and, you know, everything like that. But until you experience it, you don't really get it.
Yeah. Yeah. I don't think you know what you're going to need.
I was like, am I going to be like gushing? Like, what is going to be happening? I don't know. So anyway, I gave birth and it wasn't what I thought just because I didn't sleep at all that night.
Mm-hmm.
And I felt like I was out of it and not present, which I really wanted to be present.
Yeah.
And I also was like laying down.
Okay.
They had me laying down and I was like pulling bars to like,
oh my gosh,
push.
Okay.
And so all of my pictures, I look like a sumo wrestler. I'm not even kidding. It's so bad. And so like I didn't get the cute picture or like, you know, which is like so vain and so silly, but I wanted like the picture. You know,
I think that's fine
of like
to want a
this is the
picture.
first time I met my baby, you know. And then she came so fast that our photographer wasn't there. Yeah. And I was really bummed about that because I wanted like the here she is like picture, you know. So anyway, so I think that like the first thing, and I was told this as well. But I'm type A and I like have to have a plan. Yeah. It's like be informed, but do not like panic if it goes awry.
Yeah. Yeah.
Because nothing's going to go.
That's good advice.
Yeah. Yeah. Just go in with like, the way I like to think about it is just like knowing like the potential of what can happen, what is going to go on, and just like living in the moment and like living through the experiences.
Yeah.
Let it be.
Yeah.
Yes.
I tell people, and maybe this is just based off of my experience, but when people are like, oh yeah, this is like my birth plan, I'm like, you should have no plan for a birth plan.
I know.
Like my birth plan was no plan because if I would have created it, I would have set myself up for so much failure.
And not even just like, because of course you didn't fail, but yes, in your brain, you're like, I didn't get to do any of those things. Yeah. I failed my birth plan.
Yeah. Well, like I failed in the sense of like, I would have been disappointed if I would have like really been so adamant about wanting something and then not having it. And then I think it would have like just made the experience, I think, scarier, more stressful. Yeah. All of the things.
Yeah. Oh, I totally agree. Yeah. It's good to have like, I don't want to have this or the daddy stitch or like, you know, the things like that. But like all in all, the baby is in charge from that point forward, you know, since the second you get pregnant.
Oh, yeah.
Okay, so I'm just kind of reflecting on like what I would tell someone how to prep for postpartum. So I think a couple of things that I found out after birth and like through my, I was going to say like new mom stage. Yeah. A newborn mom stage is that your pediatrician actually gives you free formula. Yes. And you can try any kind of formula and see if it works for your baby.
Instead of buying like big old things.
Yes, exactly. And that it was so helpful to find out, especially when it was like, oh my gosh, formula is so expensive. This baby is so expensive, especially with your first. Yeah. When you're just like you're like, whoa.
Oh my gosh, yeah.
I just paid $10,000 for a baby or whatever it is. But so that's a resource. You can get formula there. I ended up pumping for 4 months and supplementing with formula. Nice. And so we needed lots of formula. Yeah. So that's a good one. Another good tip is to spray in the peri bottle through hot water.
Oh, yeah.
I had a really good nurse who said, just like as hot as you can stand it, that'll get the red blood cells there and like help mend you.
Oh my gosh. Yeah. I didn't even think about that.
Yeah. It is an interesting feeling.
Yeah.
But it's good and it helps. My daughter was teeny tiny, but she ripped me end to end because she came out with her elbows up, ready to fight.
Well,
like, yes, I know. She just like, oh, yeah. Oh, I just remembered something my doctor said, and I just like, it gives me the
oh my gosh, I need to hear.
My doctor said it's like trying to stitch saran wrap.
Oh my gosh.
Can you? What? I was like,
how do you even do that?
Part of me?
Yeah.
Like, what? It was so shocking.
Oh my gosh.
That gives me PTSD. But anyway, it's all good. It ends up good. But anyway, so I would plan on that. I would plan on just having snacks and water everywhere in your house.
Yes.
Because you don't know when you're going to get nap trapped. You don't know like when you're going to be able to get food for the next time.
Yeah.
And stuff like that. So I would do that. The next thing is I would always recommend to pee before you get your baby.
Oh.
Pee before you get your baby.
Yeah, smart.
Yeah, because then you also don't know when you're going to get nap trapped, when like how long you're going to be. My daughter had colic, so we held her a lot for the first like 6 months. And I'd always like be like having to wake up my baby because I was going to pee my pants.
Yes.
Which sometimes I think it would have been worth it.
Yeah.
You know?
I mean,
you got to do what you got to do.
Oh yeah. I'm like, motherhood has made me like stoop to an all new, like,
I know.
I got no shame anymore. So
do you know what I did on my way here?
What?
I dropped my hot dog. I know you and Susan were talking about hot dogs.
I love hot dogs.
I dropped it.
Where? On the ground?
On my front porch.
I would have still ate it.
Rinsed it off.
Yeah.
And I ate it.
I honestly don't even think I would have rinsed it off.
You just like pick out the hairs. And
I'm just like, stuff. Whatever, blow it off.
I know. I was like, what has happened to me?
Oh yeah. No, I'm like, you just like.
I got like antibodies or something.
Yeah.
Right?
No, you for sure do. Yeah. Healthier and stronger for that.
Mm-hmm.
I would say too, like another thing, prepping for postpartum, especially if you're a C-section mom, I think mobility is a little bit hard too. Would just be like making sure that you have some sort of like caddy right by your bed of diapers, wipes, burp cloths, extra blankets, extra things, because trying to get out of your bed, at least for me, the first like few days is rough. Like I really couldn't do it. That's why I was like, the hospital was so nice because it has like the beds. That like gets you out. Yeah, that would be like one thing. And then also, as far as peri bottles, you said this and it made me think of it. The Freedom Mom peri bottle is superior.
Yeah.
And like get 2.
Yeah.
Like it's nice to fill them up and then have them in your bathroom and then like have 2 instead of like rinse. And then, you're like, maybe I need another one.
Right.
Yeah. So I say get 2. And like
2.
Get a little basket for your bathroom.
Make it cute.
Too.
Yes.
Yeah. I'm like, throw all your goods in there. And then let's see, the only other thing I would say as far as like breastfeeding and things go, I don't know if you were the same way, but I'm like, my nipples hurt so bad when I was like trying to get her to like latch and stuff, that like when she would latch, it would take my breath away. And so I ended up getting these like little reusable, I don't know, like
nipple shields.
They were like, so I got a couple different things. I like tried all the nipple creams, but they were like little ice packs for like your nipples. Yeah. And they were great. So I'm like, maybe if you're thinking about breastfeeding, it can be ouchie wawa.
Yes.
And it's like, I would try the creams and stuff too, but then I do have to like wipe off the creams before you feed them and all this stuff. So I'm like, I felt like the ice packs were just probably one of the most helpful things.
I think you and I both had like a hard time breastfeeding.
Yeah.
There are moms who love it. My mom loved it.
Same
and she
with
did
my
it for
mom.
a year.
Yeah.
Yes. Yeah. And so whatever your experience is, like, take this with a grain of salt.
Yeah.
But yeah, I couldn't even get her to latch. I got her to latch like once.
Yeah.
And so I just pumped.
I think that's like so incredible that you pumped though.
Something like that. I don't know. I
easy
just
task.
did not have a good relationship Yeah. And I thought I would make so much milk because I got big knockers.
Yeah, I thought I would too.
I know. And then it was like, 2 ounces.
Yeah.
And then my friend would make like 10 ounces in like 10 minutes.
In like a sitting.
I know. I'm like, okay.
What is happening? Yeah. I'm like, if it doesn't work out for you, I'm like, that is so fine.
It's so fine.
I was so much happier once I decided to stop. And my baby was happier.
Yes. Yes. Happy mom.
I think I did it for like maybe 2.5 months.
That's awesome.
Yeah. And it was great. And I'm like
so
proud of myself. And I think that's great. But then I also, when I had my second, I decided I didn't even try to breastfeed her because I'm like, I'm not doing this.
Yeah.
And that's great. And she's great.
And she still eats old fries off the van.
Oh, she
carpet,
does. Oh, she does. Yesterday she ate an apple slice off the ground at McDonald's.
Oh, yum.
So that's a next level of gross.
Yes, that's some serious antibodies.
I didn't stop her because I was just like, she's already getting it.
Yeah.
So,
oh my gosh. Okay, I have another question for you. What advice would you give to a mom who is having a second or, someone who's prepping for that journey?
Yeah.
Like, do you have any tips and tricks for that?
Yeah. So, and I'll say this, and I don't mean it in any negative way or anything like that, but I've had quite a few people come up to me after like I've talked about having a second, and they're like, you're the only person that was like real with me on how it was. Having a second kid really rocked my world. Like the transition from 0 to 1 for me didn't feel that hard, but from 1 to 2 shook me to my core. I think partly because my second was a hard baby and my first was so easy. So I was like, I had that kind of comparison situation. And then I also had bad postpartum depression with my second. But advice would just be like, know that it's going to be hard. I think if you can set that expectation of like, know it's going to be hard. And then my advice too would be like, allow people and schedule things for people to come pick up your kid, your first kid, so that you can have and really soak in that newborn time with your second, because it's so different going from 1 to 2, where it's like when you have one, that's like your top priority and you just have one and you can cuddle and snuggle and really soak it in. And that was so helpful. So know that it's going to be hard. And adjust your expectations that way. And
let people help you.
Yes, let people help you. And like, you're going to be stretched thinner than you thought. Yeah. And then it would be, arrange play dates, have activities, have things for your second. Also, like, I did like toys and stuff from Nora to Liv.
Oh, cute.
Just like a big sister gift.
Cute.
I got her like a new doll and like baby diapers to like change her diaper, like her baby doll's diapers too. And I think that helped too, because Liv was so jealous too of Nora. She? Yeah. Like to a point where it was like actually a little scary, where I was like trying to rip clothes off of her, trying to like rip her out of the DockATalk. She was like, oh, that was mine.
Oh.
So it can be challenging. So just know that,
it's going to be challenging. Oh my gosh. Yeah. I've heard that a lot, where it's like common for the first to be like an angel baby. And then you're like, oh, this is hard.
My second's 2 and she still doesn't sleep through the night.
Oh,
so I'm like,
I'm so sorry.
Oh, it's okay. It's my husband. He gets up.
Nice.
Yeah. I'm like, I don't wake up.
Yeah.
I wish I did, but well, I don't wish I did.
Yeah. That's a great thing for him to be in charge of. Yeah. Equal. I love that. And I love, like, my husband and I have that kind of relationship too, where we're like, we both work and we both work with the kid. Like it's kind of like that. But
1000%.
I wanted to do a tiny plug for firstborns that are crazy.
Yes.
Because my firstborn was crazy. It's crazy. Yeah. Like, and I love her to death, but she had colic, screamed and screamed and screamed every day until like 6 months.
Oh, that
was so hard. And I just like, everyone around me was just like, don't you love it? And I was like, wow, no.
Yeah.
This is the hardest thing I've ever done, you know? And so I'm kind of like praying I get an Uno reverse.
Yeah.
Or like my second is
redemption, baby.
Yeah.
Yeah.
So we'll see.
I love it.
Fingers crossed.
What advice would you give somebody like prepping for postpartum?
I would say kind of similar to what you just said, just like let people help you.
Yeah.
And here's like a little clue that you might have postpartum depression or anxiety, okay?
Yeah.
If the idea of someone helping you makes you want to die, you might have postpartum anxiety or depression.
Yeah. I think that's fair.
Literally how I was for almost the first year is like someone would be like, well, let me watch her. And the whole time I was away, I'd be like, oh my gosh, I'll text. And oh my gosh, I'm
and then it's like not even worth it for you.
I know. Yeah. And then it's not even worth it. I don't get a break. I'd literally like, even when my sweet husband would like take over for her colic times, I would like watch the monitor and watch him taking care of her and just be like so stressed.
Yeah.
And that should have been a clue that like something was more extreme than just like baby blues.
Yeah.
So get help. We've talked about that before.
Totally.
And then my best tip is to get outside every day.
Oh, yes.
Especially with your first. And I know like I had mine in the middle of winter, you know, but go somewhere.
Yeah.
Like make plans with a friend to sit on their floor and like watch a show or something.
Yeah.
And just get out of the house. I feel like
that definitely helps.
Yes, it helps so much. Like see the sunshine, get that sunshine on your baby, you know, things
like that. Go stand on like your deck.
Yes, go stand on your deck. Oh, I thought of another tip.
Okay.
Get a sleep training program.
Oh, yeah.
Learn all about baby sleep. You know, you don't have to let them cry it out.
I probably should have done that.
Like, I'm like, do it. I'm like, your 2-year-old newborn.
Yeah.
Just kidding. You can still do it. Get the taking care of baby's 2-year-old one.
Yeah.
That one is so great. I like combined multiple.
Okay.
We should talk because I like literally read every baby sleep book.
Oh my gosh, we need to do an episode on baby sleep.
We do. And so I compiled this huge like workbook of like how to get your baby to sleep. There's this method and this method and this method. Do what feels right for you. If it changes, like just go with the flow. Like what does your baby need?
Yeah.
Wake windows and like nap times. And you have to wake up your baby sometimes to keep them on the schedule, like stuff like that.
Yeah.
So I became obsessed with that. And so, you know, tune into our baby sleep episode.
Oh my gosh, we need to.
Yeah.
I love it. Okay, well, thank you all for tuning in and we'll see you next time.
See you next time.